Two different inheritance diseases caused by protein receptors and channels mutation are familial hypercholesterolemia and cystic fibrosis. First, we will start with familial hypercholesterolemia. Familial hypercholesterolemia is a common genetic condition that causes high cholesterol level. They have a high amount of low-density lipoprotein, LDL, due to mutation in one of the genes that control the way cholesterol is cleared. Cholesterol accumulates in the walls of arteries, which is called atherosclerosis, or they can accumulate in the skin, named xanthelasma, or in the tendon called xanthoma. People with familial hypercholesterolemia have a 5 times higher risk for coronary heart diseases. Cholesterol and triglyceride are insoluble in water, and therefore they should transport it in association with proteins, so they form a complex particle called lipoproteins. Plasma lipoproteins can be divided into chylomicrons, chylomicron remnants, VLDL, IDL, LDL, and HDL based on size, lipid content, and apolipoproteins. Chylomicron remnants, VLDL, IDL, and LDL are all pro-atherogenic, while HDL is anti-atherogenic. The exogenous lipoprotein pathway on the left in this slide starts with the incorporation of dietary lipids into chylomicrons in the intestine. In the circulation, the triglyceride carried in chylomicrons are metabolized in muscle and adipose tissue by lipoprotein lipase, releasing free fatty acid, which are subsequently metabolized by muscle and adipose tissue, and chylomicron remnants are formed. Chylomicron remnants are taken up by the liver. The endogenous lipoprotein pathway on the right begins in the liver with the formation of VLDL. The triglycerides carried in VLDL are metabolized in muscle and adipose tissue by lipoprotein lipase, releasing free fatty acid, and IDL are formed that may be taken by liver or metabolized to LDL taken up by the LDL receptor in numerous tissues, including liver. Mutation in the LDL receptor gene is the most common cause of this condition. As a result, people with this mutation have very high level of blood cholesterol, which is deposited in tissues such as skin, tendons, or coronary arteries. The abnormal cholesterol clumps in the coronary artery will narrow the wall and can clog the artery and restrict the flow of blood to the heart and increase the risk of heart attack.